Karen McGivney Liechti. I'm a certified nurse midwife at CHI Health Birth Center here in Lincoln, Nebraska. One of my gifts is being kind of a burr in people's bonnets. So my role in this project mostly was to envision it and push it and present it to the people that have the power to make it happen. This was the dream of my partners before me, my mentors, Geraldine Schumacher, Nancy Peterson, Vic Waymeyer, Joanne Bronson, those pioneers for midwives and women's care in Lincoln. They wanted a birth center really bad in the early 90s and tried really hard to get it to happen. And it didn't happen, and it just wasn't time yet in Lincoln. And then my daughter had a baby in a birth center in Austin, Texas. And I came back like on fire, like, we need this for Lincoln. I got invited to come to a perinatal strategy planning meeting. And, you know, they're popping ideas. And I'm like, good idea. And did it and put a business plan together and gathered people that are way smarter than me to actually make it happen. Our birth center it's not just a place to give birth, it's also a place where we give care, and not just care to pregnant women. I mean, at my point in my career, probably a good half of my patients aren't having babies anymore. I mean, they see me for their gynecological care. We do women's health, a lot of women's health. The word midwife means with woman. So we like to say that we're with women for a lifetime. And so the birth center, yes, we have patients here that have babies here. Yes, that's part of what we do. We also have patients who say, you know, that's really great, but I want to have a baby in a hospital. And we're like, great, we can have a wonderful birth in a hospital. I will go with you when you have your baby in the hospital, or one of my partners. We also give good gynecological care, you know. So midwifery is about a lot more than just being with a woman during her birthing time. The correct answer is Mother Teresa. That is the correct answer. Or the pioneers of midwifery like Helen Barney or Mary Breckinridge. Those are the correct. My real answer is actually the women. When I care for a woman who is just fighting for birth and working hard, um, I'm inspired. I'm inspired when a woman, her birth doesn't go anything like what she'd hoped for, and you know she has a C-section or something, and she processes that and she's okay with that. I'm inspired by my friend who has breast cancer and still gets up and goes to work, and I'm inspired by my, you know, women in their middle life that are balancing caring for an elderly parent, and they got a kid in college and they're going through their own life changes. Women inspire me. I think working in healthcare is is a wonderful ministry, and I'm grateful that's what I was called to. I mean, if you're well fitted to it, you should do it. The world needs it. The world needs women and men who want to serve and care for one another. As women, we need to bring our feminine genius to the world. We need to help change the world from within with what we are innately really, really good at. Find out if it's your calling and do it. Work for a while, get your feet wet, make sure it's what you really, really love, and then do it.